It is Thursday, August 5th, a very rainy day here in eastern Nebraska. A lot of thunder overnight. I'm sure a lot of you heard it. This is Colin Adler Ruane and Angie Lauritsen from Nebraska for Us. And we're here today to talk about Medicaid cuts and what has really been happening in the last few days in Nebraska. So on Saturday, there was a bit of a change. We entered a new phase of Medicaid cuts, and now the first people identified are starting to get dropped off their coverage. This is all part of a very long process. This has been going on for months. The other part that's interesting about this is Nebraska is the first in the country to be implementing these cuts. The state is doing it several months earlier than others. So a lot of states around the country are kind of looking to us to see how all of this goes. And so we're just keeping an eye on things on our end and watching what's going on. And Angie, one of the big things that you're really focused on is the fact that there's a lot of confusion. Even
hmm
a lot of people who are supposed to be in the know can't really fully tell us what's going on because there's just that general lack of clarity. So would love to hear a little bit more about what we don't know, I guess, but just understanding there is a lot of confusion out there.
Yeah, and I want to be super clear. I'm not a Medicaid expert either. We have been reading up on this. We've been trying to disseminate all of the information that has been provided to us, which is not a lot. But what we know is that these cuts point towards the Medicaid expansion that went through a ballot initiative here in Nebraska, and it was voter approved across the whole state back in 2018. Then Governor Ricketts slow rolled implementation, so there was a lawsuit at that time, and it was finally implemented back in 2020. And it increased the amount of people that were able to have health insurance, which is great for our community. The more people that have accessibility to healthcare and affordable healthcare, our communities um, prosper when more people are have access to healthcare and they're able to get that. But what we're really seeing is just a lot of confusion across the board because a lot of people, if you're on Medicaid, you don't know if you're part of Medicaid expansion or not, and whether you're the reasons why you are on Medicaid pertain to that group or not. So we've seen a lot of confusion already, especially with those that are trying to call in, ask a lot of questions about their renewal period and if they are part of this. They're being, there's an assumption that everyone is a part of Medicaid expansion, and that's not true. Depending on any diagnosis that you might have, any medical frailty that you might be a part of. There's a whole list of different diagnoses that fall within that medical frailty, and so there's just a lot of confusion for from a lot of people. So we currently know that there's approximately 200 people that'll be dropped for the month of August, and we also know that every single month there's going to be a whole new group of people that are going to be dropped. And so whether you are not checking a box or you haven't submitted all the information, there's different rules that will be coming out pertaining to medical frailty. So, will cancer patients be losing coverage because their doctor says that they should be able to go back to work? Those that have been diagnosed with HIV, multiple sclerosis, Parkinson's, there's just a lot of different diagnoses that it'll be interesting to see what really happens when if these definitions come out pertaining to medical frailty and what that kind of looks like for Nebraskans moving forward. One of my biggest fears is that your family physician is now in charge of alerting the state whether you can work or not on good days or bad days. And a fear that I have is that people that are facing cancer treatments start to not do those treatments because they lack health insurance, because they lost their Medicaid coverage, because their doctor said, no, they'll have bad days, but they should still be able to work during their treatments and stuff. And so we all know, we all have family members that have faced these types of diagnosis, and we know that there's good days and we know that they have bad days. We also know that employment is not always super secure in our communities too. So, if you're not able, if you have a job, or, a stable job, but you go in and it's not stable in the fact that hey, we don't have as much work for you to do today, so we're going to go ahead and send you home. So you're not getting the required time and hours in order to um, continue to have your Medicaid. So the working poor are definitely at risk of losing their health insurance, and so there's a lot of resources, and we could put those in the links of where people can go to try to ask those questions and make sure that everybody's as educated as they possibly can be, but making sure that like we are talking about this in a way that is supportive to those within our community, because there are so many um, confusion around the implementation of this. We're the first state in the country to start this. And so there's going to be a lot of states that are watching Nebraska and how we are implementing this. And so they're going to be watching the amount of people that come off the rolls. We're watching the amount of people and what happens to our hospitals and our clinics and our long term care facilities if they are not able to continue receiving the Medicaid reimbursements because they have less people accessing Medicaid. So it's going to be something that we will continue to work on and pay attention to and to continue to get the information out. So, with that, I'll just hand it back to you, Colin.
Yeah, and we know that broadly speaking in the public, this is a very popular program. And to kind of underscore that, we remember that before the Republican tax law was passed in July of 2025, a couple months earlier, our Congressman Don Bacon told Politico that $500 billion in Medicaid cuts was his red line. What we know is that a couple months later, the bill that was approved cut it by $1 trillion. So the attempt at reassuring the public kind of shows that there were concerns about how those cuts would be perceived. And now we're kind of having these filter through the system. One thing we'll add is that here at Nebraska for us, we'll continue tracking the Medicaid figures at the state level. Those
Mhm.
come out once a month from the Department of Health and Human Services. Just over 300,000 people in Nebraska are on Medicaid at last check from our end, and we'll continue to watch that. We've not really seen a drop in the data yet, like we have with SNAP, where we've seen almost a 20% drop since last July in enrollment there. And so there's a lot for us to continue tracking. We'll be watching it, and we'll, of course, bring you updates here on this channel and on nebraskaforus.org. Have a great day.
Thanks.